Right. So we will go to our next talk, and that is by Dr. Aditya Kelkar. As Dr. Aditya Kelkar is going to speak on the response to biosimilars in observation on OCT biomarkers in neovascular AMD. Aditya, as we know, is a prolific surgeon from Pune. He is the heart of the National Institute of Ophthalmology, and I'm very proud to say that Aditya has won the Red Buckler Award at the ASRS for his video presentation. Aditya, over to you.
Yeah, thank you, sir, for your kind introduction. So I'm going to talk about our experience of visual outcome, safety profile, and morphometric response of optical coherence tomography biomarkers to ranibizumab biosimilar treatment in neovascular AMD, a real-world experience. I would also like to acknowledge the help by Dr. Jay Seth in this paper. There is no financial interest, so I would like to start with what AMD is all about. Obviously, you all know that AMD is the leading cause of irreversible visual impairment amongst the elderly population, and with the current treatment modalities that are available include bevacizumab, ranibizumab, aflibercept, and brolucizumab, which are widely used throughout the world. Recently, in 2015, the Indian molecule of razumab was launched, and then it has become more and more popular nowadays. And however, there is still dearth of literature that analyzes the response of intravitreal razumab in various in respect to various OCT biomarkers in neovascular AMD, especially in Indian scenario. So what does this study add? It is like a real world study of outcomes of razumab in neovascular AMD. We report the short-term outcomes, safety profile, and morphometric response on OCT biomarkers of this disease activity in neovascular AMD. So it's a retrospective study of 20 patients. Inclusion criteria was type 1 and type 2 CNVM with pigment epithelium detachment. Patients with type 3 CNVM were excluded, and CNVM due to other causes and IPCV were also excluded. Simultaneously, the presence of other retinal pathologies like diabetic retinopathy was also excluded from the study. So at baseline and each visit, all the patients underwent best corrected visual acuity, intraocular pressure measurement, anterior segment evaluation, fundus examination, and swept source OCT and fluorescein angiography. Also, we did OCT angiography as and when it was possible. Each eye received intravitreal injection of razumab at a recommended dose of 10 milligrams per ml, that is 0.05 ml, every 4 weeks for 3 months. This injection was given at baseline, 4 weeks, 8 weeks respectively, and the patients were reviewed at the end of 4 weeks, 8 weeks, and 12 weeks. All intravitreal injections were performed in the operation theater under all septic precautions, and the image analysis that was obtained included the central subfoveal thickness that was calculated using 25-line raster scan protocol. Also, the dense scans were also carefully analyzed to look for maximum extent of the PED, and subsequently we also measured the dimensions of PED as well as width as well as the height of pigment epithelium detachment with the inbuilt calipers. PED was evaluated for the reflectivity, and also we tried to differentiate it into serous, drusenoid, fibrovascular, hemorrhagic, or mixed. And the sections that were also evaluated for presence of intraretinal and subretinal fluid and extent of central retinal thickness. The changes in the best corrected visual acuity, intraretinal fluid, subretinal fluid, central subfoveal thickness, central retinal thickness, and the height of PED as well as the width of the PED was compared to the baseline. All adverse events were also monitored. So the age group was 68 plus or minus 13 was the mean age group. The male to female was 10 and 50% of the 50% of them were males. And PED reflectivity, hyperreflective PED was seen in 85% of the patients, and the mixed reflectivity was seen in 15% of the patients. Best corrected visual acuity logMAR was 1.38 at baseline. The median PED height was 264 millimeters. Median PED width was 2017 millimeters. And the mean central macular thickness was 388, and central retinal thickness was 373 micrometers. Baseline characteristics about the subretinal fluid was seen in 60% of the patients, and intraretinal fluid was seen in about 30% of the cases. Compared to the baseline, we saw that the improvement in the median visual acuity was noted in all the three after all the three loading doses, although it wasn't statistically significant. At week 4, week 8, 6 eyes had more than 3 line improvement, which increased to 8 lines at the end of 12 weeks. 9 eyes were stable at the end of 12 weeks, whereas 1 eye had improvement of only 1 line. Loss of 1 line was noted in respect at 12 weeks in 1 patient. None of the eyes showed complete resolution of the PED. At week 4, 8, there was an improvement in PED dimensions, although it wasn't statistically significant. At 12 weeks, the height reduced significantly from baseline, that is 244 microns, while the reduction in the width was not so much significant. So these are some of the pictures which demonstrate the reduction in the height as well as the width of the pigment epithelium detachment, along with resolution of the subretinal fluid at 12 weeks. OCT biomarkers, again at 8 and 12 weeks, statistically significant improvement was seen in central subfoveal thickness. At the same time, also in the central retinal thickness. Resolution of the intraretinal fluid was seen in 4 eyes at 4 weeks and 8 eyes. Also, it improved in 5 eyes at 12 weeks. Complete resolution of subretinal fluid was seen in 3 eyes, 5 eyes, and 9 eyes at the end of 4 weeks and 8 weeks, 12 weeks respectively. The subretinal resolution was statistically significant at the end of 8 and 12 weeks as seen in this picture. So to discuss about what we have come out with our results, the Razumab, as you know, is the first and only Indian anti-VEGF molecule available at this point of time. We would like to report our improvement in vision at week 4, week 8, and week 12 in neovascular AMD in patients who have PED. This is obviously inclusive of type 1 and type 2 CNVMs. On the whole, the real world experience shows that the visual acuity was, the 90% of the patients maintained or improved the visual acuity at 12 weeks follow-up. The PED typically encountered in neovascular AMD patients were studied in this group. The Chan et al. Have reported an improvement in PED height and volume after intravitreal aflibercept, and the Harbor studies also show similar results. And along with that, we also demonstrate that with the Indian biosimilar, the reduction in the PED height at 12 weeks, but there was no statistical improvement in visual acuity noted in our group. Although our group has limitations of being a short-term follow-up, at the same time, the numbers are very less. That is only 20 in our group. Statistically significant improvement of central subfoveal thickness and central retinal thickness was also noted at 8 and 12 weeks respectively. Similar studies have been, results have been shown in Minerva study and also a study by Wyckoff et al. With other molecules. So the presence of intraretinal and subretinal fluid are considered to be important biomarkers for disease activity in neovascular AMD. In our study, we have noted that intraretinal fluid was seen in only 30% of the patients in baseline, and it improved to 5% at week 12. Similarly, the resolution of the subretinal fluid was seen in 45% of the eyes compared to other studies which show 53% as in Red Enact study. The better response of OCT biomarkers to anti-VEGF therapy in the literature could probably be explained by the difference in the patient population, longer follow-up, and difference in the anti-VEGF molecules, as well as the suboptimal therapeutic response, which is often reported by the real-world settings. The anti-VEGF therapy has been associated with a small increase in the risk of thromboembolic events, but our study shows that there were none in our group. Of course, our group is a very small study group, that is only 20 patients. Bevacizumab, as you know, is one of the cost-effective drugs available at the point of time, but it doesn't have the FDA approval, and the other molecules, which are imported ones, are slightly expensive than what is available today. So this gap between the cost price can be effectively taken care of by this Indian molecule, which is now approved for AMD use and is being widely used across the country. Of course, there are limitations in this study. It's a retrospective design, limited sample size, doesn't have a control arm, short-term follow-up, and we did not perform ICG in all the cases. But the strength of this study is that it's one of the first studies which reports the efficacy of the real-world data of Indian molecule of Razumab. It also provides the qualitative as well as quantitative assessment of Razumab on various OCT biomarkers. So to conclude, the use of intravitreal Razumab is an emerging biosimilar which has promising morphological outcomes OCT-wise, besides maintaining stable visual acuity with acceptable safety profile. In addition, the low cost favors its use in Indian scenario, and the treatment cost almost is reduced by 25 to 50% as compared to the branded drugs. The original article could be found in Indian Journal of Ophthalmology if anyone is interested. I once again thank the All India Ophthalmic Society and INTAS for including me in this instruction course. Thank you.